the way it's structured, like you see there we have primary care or GP, same way here, and then you get referred to the hospital. So in general, it's very similar, and both are free health care systems. But the NHS, I feel like, is very organized. I like the way it's organized, like where you have a 2 week referral rule, where they work exactly with the 2 week referral, and everything is very organized. Yeah, and I think they always complain of shortage, but I think we have shortage here in Kuwait, not there.
What do you mean?
Like I think the shortage, like if you go there, you hear the doctors in the UK, they complain of being understaffed.
Yeah.
Or there is shortage, but I think their ratio to patients is better than ours here in Kuwait.
Really?
Yeah.
That's really interesting. I was under the opposite impression.
Yeah, well, to be honest, I feel like here we're understaffed. I believe we're understaffed.
Interesting.
Yeah.
In across the board, like nurses, doctors, everything, or just doctors?
I believe mostly nursing staff.
Nursing staff.
Yeah, I think the ratio nursing to patients in Kuwait is not the best.
Yeah, definitely. I agree, and it does impact our practice.
Yeah, it does.
Good nursing care is something that is so essential. You know, studies have shown that nursing care is more essential to patient outcomes than doctor care.
It does make sense because they have most of the interaction with the patient.
True.
Yeah.
That's definitely a plus of the NHS in terms of nursing. Honestly, a shout out to them because they are really good nurses.
Yeah.
Really, really good nurses. Now, would you, on the whole, say that the NHS is better or worse than Kuwait?
Well, it's not a fair comparison, to be honest. You know why? Because UK is way older than us. It's been a country for so long, and we're a new country. We've been around from compared to the UK, obviously. So their system, and they're used to having administrations and dealing with the big communities and populations. So I think they're better in organization. We could improve our organization here, like the whole administration and how things flow.
I'd agree, definitely. And I've actually heard somewhere, I don't know where exactly, so don't quote me on this. And if for any of our viewers out there, if I'm correct or incorrect, please do comment or send us a text, a DM or something to comment on this. But I believe Kuwait's medical system was based upon in its foundation based upon the NHS. Yeah.
To be honest, it makes sense because if you remember how things are in the NHS, they're very similar to here in the UK. They're very similar, and I think it's quite similar. We have the same like pathway into a clinic. Like how do you get to a specialty clinic as a patient? There's the same pathway in UK and the US.
And I actually just realized we never said what NHS stands for. National Health Service. Yeah. For anyone listening and you're a bit confused, it's the healthcare system of the UK.
Yeah, it's basically the public healthcare system of the UK.
Now, how do you feel about the current state of the NHS? Because I think the NHS on paper is very excellent and amazing. Yeah. But how do you feel about the current state? Because it's something that I think we should bear in mind, especially if someone wants to go and specialize there right now, because they're going to work that system.
Yeah, I just want to go back to your question, difference between, you mentioned Kuwait. I think we have really good doctors, like extremely good doctors. So the people like here are very good. It's just the administration, the organization, how things flow. Like the fact that we're still in some wards, we're using papers. I think that's
electronic and it's all mixed.
Yeah, I think that's a downfall, or things get lost easily. Yeah.
So the main advantage of the NHS would be the administrative.
Yeah, that's basically, I believe that. But with regards to members of both sides, Kuwait and there, I think we have very good doctors.
But now, would you say all of this still stays true? Going back to my next question is the current state of the NHS. Do you think this is true for the current state of the NHS, what we're talking about?
Well, from what I saw, because I didn't try another healthcare system, I will try the NHS. From what I saw, I think it's working well. It's working well. They're giving patient care. Maybe they feel understaffed with regards to doctors, which makes sense. They are understaffed.
Mm-hmm.
I won't deny that, but not as understaffed as other places in the world.
Mm-hmm.
So the state now of the NHS, maybe the salaries or the wages.
Yeah, they're voting on striking very soon.
Yeah.
Yeah.
Well, I think for what they do, I think they're not being paid enough.
Yeah. Well, I mean, about the NHS right now, I think we should definitely bear in mind for anyone who wants to go and specialize there, because they recently opened the board with Kim's, right?
Yeah.
I think they should definitely bear in mind that there is right now a bit of a fight going on between the NHS and kind of the government, or I mean workers and the government, in the sense that they're trying to reform things.
Yeah.
This is not exactly cruise control time. Things are not at their baseline right now in the NHS.
Yeah. It's not as stable as when we were there, because in general the UK, like every sector of the UK is going on a strike now.
Yeah, that's
Yeah,
true. I mean,
so-
COVID really came and shattered everything for
Yeah.
everyone. So it's definitely a shame, but
Yeah.
what can you do? Do you think your experience in the NHS made you a better doctor?
Yes, especially when it comes to work ethics, punctuality. Like I'm really amazed with how punctual they are there. Like when they say,
So Kuwaitis are not as punctual.
it depends on yourself, but I am talking about myself. Like if you give me time not to arrive, like if you tell me 8 to 8:30, I'll arrive at 8:30.
Mhm.
But for them, they're very good with that.
I had a friend of mine the other day. We were meeting for coffee, and they told me, right. So I think it was like 5:30. They were like, okay, 5:30 British time or Kuwaiti time.
Well, exactly.
And then I said British time, and I was late. So
Yeah. I think it did make me a better doctor with regards to the work ethics and being punctual and like in general patient care. Like they really care about their patients there.
Yeah, and it definitely shows in the way that they carry themselves. And the nice thing that I appreciate about the UK is that the way that people work there, it's not about the money.
Yes, exactly.
It's never about the money.
Exactly. Like even if let's say they finish at 5.
Mhm.
Also something for you guys to know that their working hours there are way longer than Kuwait.
That's actually really important to remember.
Yeah, it's so you need to put that in perspective when you go there, especially whether you're going for a specialty or you're going as a medical student. We usually work from 8 or 9 till 5 p.m.
Yeah.
So they're even if they're done at 5, some of them stay till 6 or 7 just to complete their jobs.
Yeah.